Moving on to Ghana, several times on this show I've boasted about the beautiful hospitals that Ghana is building while we have crappy ones in Nigeria. But you know, lately I've been getting a lot of complaints from Ghanaians about something that is not just happening in Ghana, because this is also happening in Nigeria, so we are not better off. I'm talking about the attitude of some doctors and nurses. Notice that I said some, because there are great doctors and nurses out there, people who actually care, people who truly care about their patients. Thank you so much for what you're doing. But there are many doctors out there who just want to make money, and nurses who treat patients as if they are doing you a favor. Hey, keep in mind that you are paying for the service, so you are paying for it, and they will treat you as if you are inconveniencing them. How bad? The devil is a liar. You know, I was shocked when someone sent me this video of two Ghanaian nurses who went live on Facebook while at work.
Hello, work is fine. My boyfriend is calling me. I'm at work. Hey, I should get my ass back to work. No one is here to work. What's up? Moving me so can't we play at work? My boyfriend is darling Gage. Hey, we said kiss me.
Can you believe, even though this video was published in August, it still baffles me that it happened at all. Of course, when the video went viral, both of them were fired. Their names are Trudy Marcel. Trudy is the popular one, by the way. Ooh, she became really popular. And the other lady is Rama too. But then they got some influential people to plead for them. They even said that they didn't shower for days. So they got their jobs back. Unfortunately for Trudy, last month, her boyfriend's mom's house got burnt. Apparently, she lives with her boyfriend who lives with his mom. So I feel bad that the house got burnt. But you know, I still cannot help but wonder if some people understand what it means to be a medical practitioner. A friend of mine in Ghana was told that she needed an urgent surgery. They told her that if they don't operate on her, if they don't do the surgery right now, that she would die. But after rushing her into the operating room, they left her there for hours. Unknown to her, they told her friends that if you don't come up with $2,500 cash, we won't do this surgery. And you know, they did not touch her. While her friends were running everywhere trying to raise the money, they didn't touch her until the money was completed. And you know, the one that touched me the most is the fact that because they left her in the operating room, she was bleeding internally. And because of that, they later told her that they had to take out one of her fallopian tubes because she had bled for too long. I'm like, it was your fault that she was bleeding. You were supposed to do the operation immediately. And the ridiculous thing is that as soon as she woke up the next day, they gave her another bill, which was even more than the one they told her friends to look for. And you know, she sent me the picture of that one. It says on the bill that 100% deposit of estimated cost is required within 24 hours. Now, another friend of mine in Ghana, whenever they gave her drip, the nurses did not monitor the drip. So each time it finishes, there's nothing for her to press to alert the nurses. So blood will now start going into the drip. So she would have to work with the drip despite her pain to go out to go and call the nurse to come and remove the drip. Can you imagine? Now, another friend of mine in Ghana, her mom had stroke. So she called the ambulance, you know, like calling 911. You know, they told her there was no ambulance. As imagine calling 911 and being told that there is no ambulance. So then she called her friend who knows the Minister of Health, and within 30 minutes an ambulance showed up from the same company that told her they had no ambulance. And then the funny thing is, when the ambulance came, they told her that they didn't have fuel in the ambulance. So they refused to turn on their siren until they went to the filling station and she bought them fuel. That was when they turned on the siren. Like, it suddenly became an ambulance. Before, it was operating like a normal vehicle. I think I've spent too much time in America because Ghana, why now? Charlie, why? Just imagine 911 911 branching at the gas station when you are trying to rush a patient to the hospital. And then they are telling you you have to pay for the gas. Later on, they needed to transport her mom from that hospital to another hospital. Now, the ambulance was there this time around, except they could not find the driver. They couldn't find the driver of the ambulance. There was only one ambulance, and they couldn't find the driver. I shouldn't be laughing about this because it was a critical situation, by the way, that they needed better medical care, so they needed to move the patient to another hospital, and they couldn't find the driver of the ambulance. But these were supposedly the best hospitals in Ghana. But you know the one that got me the most? As in, I don't want to go into how they were lifting a stroke patient with the hand that was paralyzed, as in just yanking a patient with the hand that was paralyzed. Now, this happened at Bemwa Hospital in Accra, which is reportedly an international hospital, as in they call it American hospital. So I don't know why this is happening there. But you know, the truth of the matter is that we're not better off in Nigeria. Not long ago, a popular Nigerian actor, Yomi Gold, was crying on Instagram because he lost a friend who had surgery in Nigeria, and he was saying that if you can afford it, don't do any surgery in Nigeria. People that don't have to die are dying every day in Nigeria. For the last 6 years, I've been shouting about building us good hospitals in Nigeria, but you know, a huge part of our problem is the attitude of our healthcare practitioners. Yes, some of them, not all of them, but a lot of them. A woman gave birth in Nigeria recently, and she was detained. They detained her and her baby in the hospital for 4 months because she couldn't pay 215,000 naira. That is about $600. And then the father of the baby said that they even threatened to sell his baby. Now, I don't know how true that is, but that's what he said.
They locked me up and said I must produce their money. I was embarrassed. Because of that experience, anytime I want to go there, I become scared. At a point, they threatened me that they would sell my baby over the bill. The hospital denied threatening to sell the baby.
Wow. Now, I need to say this. I do understand that in Ghana or in Nigeria, people may live without paying, and that a lot of people may run away without paying at all. But you know, that's why our government need to make health insurance compulsory, and they need to provide health insurance for people so that no one will be treated like crap, and hospitals can just deal with the insurance company to get their money. Enough of treating people like this. Here in the US, doctors and nurses go all out in making sure that a patient is comfortable as he or she recovers. You know, I once had a loved one admitted in the hospital for days. I watched a lot of nurses. I watched nurse after nurse as they were going through their shifts. They each had a mobile station which they were wheeling from one patient to another, and they would be on their feet for hours. I was like, I had no idea that nurses work this hard, constantly monitoring each patient. They will bring breakfast, lunch, dinner. In fact, I couldn't sleep because they kept going in and out through the night. My patient was sleeping, but I kept waking up whenever they would come and change the drip or just check on the patient to make sure that the patient was okay. And you know, the funny thing, the whole time no one said anything about money. Even if your bill is $40,000 or more, they will just send it to the insurance company, and they will also send you a copy in the mail. So the hospital is supposed to be dealing with the insurance company and not treating people like crap. By the way, there are several Africans here in the US. There are doctors and nurses, and they are treating people with dignity. Thank you so much to every one of you. We appreciate you. So it's not as if we cannot do this thing. It's just that there's something wrong with our system back home in Ghana, in Nigeria. We need to deal with the system. Some Nigerian nurses would even tell a pregnant woman in labor, they will say, why are you crying? Shut up. Shebi, you were enjoying it when you were doing it. They are talking about sex. So can you imagine telling that to a woman in labor? Now, I like to give a quick shout out to two wonderful nurses that I met. This beautiful Gambian nurse, Sainabu Nyans, and also this beautiful Nigerian nurse, Mrs. Raliat Koliosho. I met both of them at the hospital when my patient was admitted, and they took extra care, as in extra care of my patient. I am so grateful. I'm so grateful to the two of you. Thank you so much. You know, this is how people should feel about nurses and doctors. Like, people should see you and be like, thank you. You took care of me when I was sick. And I know that we can do this. I'm hoping that these women will inspire you, not just them. There are so many African nurses and doctors that are doing amazing things. And lastly, I like to thank the doctors and nurses in Nigeria, in Ghana, and in different parts of Africa. Those of you in Africa that are treating people with dignity, thank you so much. Don't think that people are not noticing. People always notice when someone is different from the crowd. You know, I decided to talk about this, not to shame anyone, but just to inspire people and to encourage our doctors and nurses to treat people with dignity. Thanks to those of you that are already doing it. You guys know I don't know much. Guess what? I'm just keeping it real.